The pandemic, in my view, has been, there was a lot of negative side of it, but the positives that have come out of it, I think, with regards to, especially to innovation, is people were forced to work differently. We worked in different areas with different teams. We adopted new technologies. We had to also focus on infection, probably, which is a hot topic anyway. But everybody had to, and I think people get stuck in their ways, working a certain way, and we were forced to really analyse how we do things, why we do things. And I think from an innovation point of view, the pandemic has almost improved the culture of change. So I think that's a really positive thing that came out of it.
It's just a phenomenally exciting time to be alive and involved in medtech sector with technological advances. There's this artificial intelligence, I'm sure, as everybody aware, so much going on in that area. So many things in nanotechnology, so many exciting new materials that are becoming available that can be used in the medical environment with really exciting opportunities arising from that. So it's a challenge for the NHS because that involves cost. And I think at the moment, as I say, the NHS is completely focused on getting better value for money for the products they buy in quantity and bulk. And I can understand that policy, that's fine, that should be managed that way. But it doesn't necessarily mean to say that every time you bring in another cheap solution from China, you're getting an improvement. And often you get a deterioration that costs more money. There's also now sustainability on the horizon. So we've got to, by 2023, be net zero in a sustainability manner. And we're working hard on that as a company, the whole industry is. I just wonder if the government realise what they have to do in terms of the costs that will be involved with that, because everything's going to increase in costs. It's the right way to go. We don't deal with China at all. We keep everything in Britain as much as we possibly can. We manufacture in Britain as much as we can. We already have that footprint in terms of logistics, which is a huge part of the sustainability circumstances we have to meet. So. A big challenge for the industry, but I don't think the government have quite caught up with the fact that they can make the policies, but they won't really be able to manage it properly, and it won't have the net effect impact that we want in terms of environmental improvements.
So innovation to me is more like a good idea, and not just leaving it, doing something about it. COVID brought that through a lot. It almost changed overnight in healthcare. So we were hearing all of the stories coming from Europe and from the Far East, and we were just waiting for the wave to hit. It was a frightening time. And what it changed, certainly from my point of view, was a mindset amongst healthcare. We become almost entrenched in historical ways of doing things. This is what we do. We've always done it that way. It's not broken. We don't need to fix it. What we realised is that there was a lot of areas we could improve that we were just coasting through. And it was a mindset of change. So we were told overnight what we've been doing, we could now do. What we were doing was now high risk. What we were now doing might mean you don't go home to your family tonight, you have to go into isolation. So we had to change the way we worked. We had no extra pieces of kit, so we had to review what we were doing and work smarter, really. And that's what it was. It was about evaluating what we were doing, and it was about doing things correctly, safely, and trying to get the best out of what we had, because we had massive issues with getting equipment and kit into the trust, because the whole world wanted all of the same kit and all of the same equipment.
The whole healthcare environment, I mean, it's a passion for me. 40 years involved in it, and it's actually me finding as a young person what I should be doing in life. I've grown up through that period of enormous change in many ways. But I think the challenge for government is that they're only there for 4 or 8 years. There isn't a long-term policy. Things change dramatically based on democracy and voting. So politicians don't like to lose votes and act accordingly, which is harmful to healthcare. So that would certainly be a prime thing for me to address. I think the big failure of government actually really comes across when you look at the last 20, 30 years. Governments have known full well that we have a baby boom generation that is going to age and like never before, in an unprecedented way, and subsequently likely have huge healthcare issues like dementia. and they haven't planned properly for that. And that's the big example for me. I think it's an interesting one in the sense that actually it's probably a transient blip, and I would imagine what will happen is after the baby boom generation, there'll be a much healthier, fitter population, as we are now. Actually, we are much healthier living, but less people entering the dangerous age health range together. But governments know that's happening. They do have plans to deal with it, but they just don't. And we should have had the resources in place to realise this is happening. It's not always an easy task, but it's been poorly managed in my opinion.